We have a keynote presentation coming up next, which will be from Dr. Mustafa, Dr. Mustafa Hasan Qurban. The keynote presentation is going to be about the role of cloud in expediting healthcare services. Dr. Mustafa, who is the director of ICT and consult at King Fahad Military Medical Complex. So, Dr. Mustafa, can you hear us?
Yes, thank you. I can hear you. Can you see the presentation? Can you see my screen?
Yes.
Yes.
Okay. Do you see the presentation?
Yes, we can see the presentation.
We can see Zoom, Dr. Mustafa.
Yeah, you are sharing screen.
Okay.
Yes, correct. Yeah, that's the one.
That's one, yes.
Perfect.
Okay. Thank you very much. Good morning, everyone. I was enjoying to listen a little bit about the previous panelist. As all of you know, that when we started the pandemic, I think a year and a half, nobody was expecting what will happen. But the demand for healthcare services is increased tremendously within few days. So everyone in the healthcare was under challenge to provide fast healthcare service, remote work, to provide data wherever you are in the mobile and the remote services. All of the services that is being provided request or required data to be accessed. Therefore, cloud was not an option. Sometimes it becomes a mandatory to expedite and to deliver healthcare services immediately or as fast as expected from the user. It was a great challenge for everyone in the healthcare services. It imposed a lot of risk as well, but sometimes it was not an option. As I said, it was something that we have to deliver. Just for your reference quickly, I just want to mention a little bit about what is a cloud computing. Cloud computing is the best what I can provide as a definition. Cloud computing is the delivery of computer power, data, storage, applications, and other IT resources through a cloud service platform via the internet or other mediums that like 5G, 3G, whatever, inside the organization. Cloud could be in the healthcare, for the healthcare as platform as a service or a software as a service. And it also has three different types. One of them is the very well known as public cloud. The other one is converged or hybrid cloud. And the third one, which is a private cloud. The difference is simple, is that the private cloud is the thing that it's in your premises. The public cloud is the cloud that is being provided by a government. The hybrid cloud is something that in between, which provides gives you the facility as either at the platform, the network, I mean, or the software. During the pandemic, all the software requirements, it's increased by almost, I would say 100%. We need to deliver quickly the pathology services. We need to quickly deliver the radiology services. We need to deliver quickly the diagnostic services as well for the medical, for all physicians and medical care staff. In addition to that, we need to provide the data for the people who works remotely. So they will have to have secure access to their either the application or the data wherever they are located. Also, the telemedicine, it's become increasingly one of the things that is required by the physicians, especially when there are COVID patients and there is no contact between the physician and the physical contact between the physician and the patient. Therefore, there was a requirement of interacting between the patient and the physician through the remote services. Also, the relative to the patient of the COVID patients who are admitted to the hospital, they need to be contacted by their parents, sometimes if they are children, or by relatives and loved ones, which they are not allowed to visit their COVID patients in the hospital. Therefore, we allowed them to access the remote services and work with interact with their patients. So these are some types of services that is being provided during the pandemic, and it's been increased. Yes, the cloud helped to provide this service quickly and to secure as much consultation that is being provided, as I said, telemedicine, teleradiology, pharmaceutical services that we provide remotely to our patients. This is some of the types that is being a service that is being provided by our hospital to our patients. So if we are talking about the benefits that it brings, the cloud that can bring to the organization, to any health organization, according to some research, it's basically divided into two things, either clinical benefits or business benefits. Some research suggests that using the cloud can reduce the operation cost by 30%, which is very reasonable percentage. However, I want to just mention something, that sometimes a cloud is not always the solution. And as some of you know, cloud is a strategical decision. It has to be taken by decision makers, by the CEO, but the CIO role is to explain the benefits as well as the risk of the cloud when you are either using the platform or using the software. As many of you know, the cloud, one of the biggest challenges that it imposes is the privacy, data privacy of the patient, as well as the security of the data. The third one is the workflow, especially inside the hospital. These are the major challenges that the cloud can provide. I'm sorry, I have some issue with the bringing the presentation. It is very slow. I think Zoom is bringing some problem. But anyhow.
Yes, Dr. Mustafa, no issues. Now we see that, yes, it's coming up.
Yeah, but it takes a very long time to upload the presentation to the Zoom. I don't know what was the issue. Anyhow, to save the time, I will try to just to get the benefit as much as to share the benefits to each one. Especially, we have a very rich experience through the pandemic, and I am sure many are interested to know. Therefore, I will speak about it. So. The major strategy which I want to share with you is that you have to be careful when you choose the cloud services and also your partner. Legality is very important, and the price as well. There are very different price strategy between vendor to another vendor. Your partner of the cloud has to be very well trusted and known. Otherwise, it's going to be an issue. And also, you as a strategical planner in your organization, you should know what are the things that you want to from the cloud and what you expect as an outcome from the cloud when you deliver the service to your beneficiaries. So. When you trust the cloud data, when you put the data in the storage of other vendor, you have to know what are these data and what are the consequences of having the data. On the other hand, if you have a private cloud in your organization, you need to also consider the running cost of the operation, and the increasing cost of operation, which is sometimes is underestimated or not calculated very well. The biggest challenge in the future about the cloud is the availability. As we said, the COVID-19 was unexpected pandemic, and even the consequences were not expected. Now, what if you have a cloud and let's say the connection between you and the beneficiaries are not, or the provider is not available? In the healthcare, this is the biggest challenge. You cannot actually spare the service for more than even 4 minutes or 3 minutes, especially for ICU patients. You need to have the ICU patient presence all the time, and you need to continue to provide the service continuously without any interruption. So in the healthcare service, is not like a banking or the aviation or any other service. You cannot go back to the paper once you already run the service electronically. We see a tremendous improvement in the healthcare services that is recently provided worldwide, not only in Saudi Arabia. There is a great growth in innovation and provide a reliance on the healthcare digital transformation of healthcare services. But also we need to understand the consequence, as I said, once the service is not available or we cannot reach to our service, this is we're going to put our patient at the great risk. So this is need to be considered, as I said in the beginning, when you draw your strategy and the plan to have in the cloud. Now, what are the things that probably we're going to have in the future for the cloud? I think, first of all, the cloud going to bring, or the services, especially software services, going to provide great benefits to and business opportunities. And there is a great opportunities now for the many business. I think that what is expected by PCG is from year 2020 to 2025. I think this is also the same. The investment going to be more than $200 billion in the healthcare sector. So this includes also the digital transformation. This is going to open a great innovation ideas and many different services. But also, we don't have to jump quickly to these services if we don't need it. I would like to share my experience. Sometimes you might get tempted by many of the services that is available, especially the new services. And once you adapt in healthcare, it will become a very problematic and burden to you. So my suggestion, before you select or choose any service, make sure that service is aligned with your organization and with your view and strategy of the healthcare organization. I will leave some time for your questions and answer. With that, I will conclude my presentation. Thank you very much for attending, and I wish you all a good day. Thank you.
Thank you, Dr. Mustafa. Thank you very much. In fact, indeed, insightful presentation when it comes to cloud infrastructure for the healthcare. Yes, we do have a few questions. However, considering the time, we'll have to probably move on to our next session. The questions will be shared with you. Of course, you can have them answered directly to the delegates who have placed that.